Hi, everyone. Thank you for joining us today. We're really excited to have you here with us tonight and being a part of this process for our school health related services. It's really important that we have involvement as we move these services forward, and we couldn't do that without your participation. So, thank you so much for joining us. I'm Jessica Levesque. I am the project coordinator for school health related services. And I want to remind everyone that we are recording today's meeting, so it will be available, which will go out in a link with a notice after this meeting, not today, but in the next day or two, and you'll have access to that. Throughout this presentation, there is a Q&A chat available to you that if you think of something as we're talking, go ahead and put that question or thought in the chat, and we will certainly use that information as we move forward with this process. Also, we will have a period of time at the end of the presentation for clarifying questions about the presentation or the survey or anything about the links that you have any questions about to clarify. So we'll go ahead and get started with the presentation. So I guess, first slide, please. So we have, as you can see from this slide, we've got a really big agenda with lots of topics today. We will get through all of that. So we're going to start with introductions of who you have on your Milliman team and who you have on the main team. And then I will go over briefly the rate determination process. And then we will do different categories. What is the school health related definitions and eligible providers? What is the school health related services? It's an overview. School health related clinic services overview. EDSS, anticipated new services overview. That's more towards the end of the presentation, so stay tuned. Please don't drop if this is why you've joined us. We want to keep you here. And then there's an interested parties engagement, and then independent rate model. That will be what's involved in the rate model. A survey demonstration where they'll walk you through the survey that we would love participation in. And again, that participation helps us with this process for services and the rate model. And we'll talk about next steps, what's coming up. And then for anybody who has some comments or questions they'd like to share, that will be the time for it at the end of all the different slides. Next slide, please. So at this time, I will have the Milliman team introductions, please.
All right, thanks, Jess, and hopefully everybody can hear me okay. My name's Dennis Finnegan. I'm with Milliman, and just a brief introduction of our team, and you'll hear various voices throughout today's meeting. So with us is Ian McCullough. He's a principal and consulting actuary. Ian provides project oversight and direction. As I mentioned, my name's Dennis Finnegan. I'm the project manager and engagement lead. We also have Jillian Zahner, who is a rate setting subject matter expert. She oversees our data analytics team, and Sasha Wildfong, a policy and services subject matter expert. So I'm really excited to be here with everybody and to kick off this rate determination process. You'll be hearing from us throughout the project, and I'm going to hand it back over to Jess for the main team introductions.
Okay, thank you, Dennis. For the main team, we have with us myself, which I've already introduced, work in delivery system reform. We have Henry Eckerson, who is the manager for children behavioral health policy. Krista Collins, who's state Medicaid education liaison. Dwayne Parsons, who's not on the presentation tonight, but he is the manager of rate setting. And we have other members that are with us on the main care team tonight, just a part of being with us for the team. We appreciate that. Next slide, please. So this is the rate determination process. So if you recall, we initiated this study on July 2nd, 2025, which meant a notice went out and said, we're going to be starting this process and stay tuned and be looking for more stuff. Today, we're doing the kickoff for survey instructions. So that simply means you see at the below, we're going to kind of talk you through what all those steps will look like at a higher level and when different parts will take place. So that will include an interested party engagement through possible provider meetings and definitely surveys. And then if there is a need, there will be a presentation for the survey results that might be to clarify any results that Milliman comes to that we need some clarification on or additional information. Then we present publicly the draft rate model and the draft rates. And after that, there's an opportunity for written comment for the draft rates. And after we receive all the comments, we respond in writing and post that on our rate reform site. Next slide, please. So the rate reform process is why we're doing these, and it's such a great process, is we have a standalone main law that's called Title 22 MRS 3173-J that's been with us since 2022. And what that does for the main care rate system is it sets a schedule for regular rate review and adjustments. So it's a system to make sure that all the different services are looked at on a reoccurring schedule. It ensures review of relevant state and national data to inform rate amounts and payment models. So meaning we look at lots of relevant data, including we're going to do these surveys to ensure we're using the most appropriate information and data to set our rates. Formalizes a clear and transparent process for a rate determination. So part of the initiation, sending out, having our meeting tonight, hoping everybody can participate in surveys. And then when we present the draft rates, being transparent where the rates came from. And then there's also a main care advisory committee, also known as the MAC. And then we have a technical advisory panel, which we refer to as the TAP. And so that's a high level overview of what the, when people talk about the main law or rate determinations, the high level, the things that we're referring to. Next slide, please. Okay, I'm going to hand this over to Dennis.
Yeah, absolutely. All right, so we're going to start to go into the review the school health related services that are under this rate determination. And so what we wanted to start with was just really grounding everybody in some definitions and terms that you're going to see throughout this presentation. So starting with schools, so they're programs that have been approved by the Maine Department of Education as either a special purpose private school or a public school, or a program operated by an approved child development services system as defined in Section 28 and Section 75 of the Maine Care Benefits Manual. We also wanted to just start with a definition of school administrative units or SAUs, and these are public school districts that manage one or more schools within a defined area. And then also the third definition is around school health clinics, which are SAUs that provide preventative, diagnostic, and or therapeutic services addressing acute and chronic conditions. So again, just kind of grounding everybody in some definitions. We're also going to, just as you'll see, the terms billing and rendering providers. And so we wanted to provide a clear definition of what that looks like under this rate determination process. So billing providers are for main care school health related services, includes a program that has been approved by the Department of Education as a special purpose private school or a public school program. For this rate determination, rendering providers for main care school health related services are when the school or SAU employs or contracts with health professionals. When the school employs or contracts with staff who will provide the health services, the school can enter a provider agreement with main care and receive payments for the covered services. We also want to note that additional billing providers are included in the EDS section. So we're going to now move on to the school health related services that are included under this rate determination. And so there are two relevant LDs that are really guiding this work. As Jess had mentioned, there's Title 22313-J, which Jessica went over in greater detail. And then there's also Public Law 2021, Chapter 227, that addresses health-related services that are required for children ages 0 to 5 years to access their education. This rate determination for school health-related services includes the following services: psychological testing provided by a school psychologist, outpatient therapy provided by a school psychologist, general school nursing services, early developmental support services, or EDSS, and that's going to be the Ruby parent training, and then EDSS school building service, as well as other services that a school health clinic provides, including preventative, diagnostic, and/or therapeutic services addressing acute, episodic, and chronic conditions. And over the upcoming slides, we're going to go into more detail about these specific services. So we're going to start with psychological testing that's provided by a school psychologist. So the scope of this service is a clinical assessment of thinking, reasoning, and judgment, meeting face-to-face with the member, as well as time interpreting test results and preparing the report of the test results. The services may also include testing for diagnostic purposes to measure a member's personality, emotions, intellectual functioning, personality characteristics, psychopathology through the use of standardized test instruments or projective tests. The anticipated new eligible providers include school psychologists that are billed by enrolled school providers only. On the screen, we provided an overview of the qualifications for school certified psychologists, and they must meet the minimum standards that include a graduate degree from an accredited program in school psychology that was approved by the National Association of School Psychologists, the American Psychological Association in School Psychology, or the department at the time the degree was awarded. They must also complete graduate work that is determined by the commissioner to be substantially similar to the other programs referred in a paragraph A, or hold a valid license from the State Board of Examiners of Psychologists with demonstrated competency in the area of school psychology through their training or experience. There's also the outpatient therapy that is delivered by a school psychologist. And the scope of this service includes outpatient therapy delivered by a school psychologist, including individual, family, and group therapy that improves functioning, addresses symptoms, relieves excess stress, and promotes positive orientation and growth that includes independent levels of functioning. The anticipated new eligible providers include the same school psychologists that we just reviewed for the psychological testing. The qualifications align with as I mentioned, this psychological testing, and this will be for qualified school certified psychologists. And I'm not going to go through all the qualifications that are on the slide as I just went through them, but they are listed on the screen for you to review. This also includes general school nursing services, and so this is going to be a new service. The scope of the nursing services includes nursing services that align with the nurse's scope of practice. One of the key things that we want to note is that this is outside of private duty nursing, as that is currently covered in a school setting in accordance with the Main Care Benefits Manual, Section 96, for private duty nursing and personal care services. And part of the survey that Jillian's going to go over is that she's going to capture, an understanding of your experience of what services are being provided in a school by school nurses. Eligible practitioners include registered nurses as well as advanced practice registered nurses, or APRNs. And the qualifications include current state of Maine license as a registered professional nurse, Maine Department of Education certification as a school nurse or meets the eligibility requirements, a minimum of a baccalaureate degree completed from an accredited college or university, and holds a valid state of Maine criminal history record check approval. As we mentioned, as part of this rate determination process, we're also going to be reviewing school health clinic services. And so we've provided an overview of school health clinic or ambulatory care clinic services, which are in a school health clinic that perform preventative, diagnostic, and/or therapeutic services addressing acute, episodic, and chronic conditions. We've provided on the screen a list of covered services, which include preventative, diagnostic, and/or therapeutic services for acute, episodic, and chronic conditions furnished by a clinician's professional staff, supplies commonly furnished for the provision of these services, and basic lab services essential for immediate diagnosis and treatment. On the screen, you'll see that there is a number of eligible practitioners that are either employed or contracted with the schools. They include physicians, nursing practitioners, physician assistants, LCSWs, licensed professional counselors, alcohol and drug counselors, registered nurses, licensed clinical professional counselors, psychologists, respiratory therapists, nurse midwives, and also other qualified staff. So under this rate determination process, the Maine Care team will be issuing a survey to help inform school health clinic service design and coverage of future services. So I want to just really stress that this is a future survey that will be coming out after this meeting. The survey is intended to collect information to support an understanding of current experience with school health clinic services. We're asking all school health administrative units and billing providers that are delivering and or anticipating to deliver school health clinic services to respond to the survey. As I mentioned, the survey is anticipated to be released at a future date in June, and interested parties will have approximately 2 weeks to complete the survey. So I do want to stress that under this rate determination, there are going to be two different surveys. One will be released at a later date in June, and the other one, which Jillian will be reviewing during today's meeting, and both will be available and posted to the Maine Care website. This survey for the school health clinic services can be accessed via a web link, and it'll be a Microsoft form. And within the survey, there'll be instructions that'll be embedded within the template and available in the form to help support your completion of the survey. I'm now going to hand off the presentation to Sasha, and she's going to review the EDSS services.
So for this section, I'll be covering the potential new early development support services and providing an overview. So early developmental support services, the potential new service, just providing a little bit of background on the rate setting process. The following slides contain descriptions of a brand new set of services and credential that remain in development. This anticipated information is being introduced now to solicit feedback on potential rates based on the current design. Please use the service and professional credential information provided on the following slides for the purpose of providing input on cost in the survey, assuming the service design is implemented as outlined. All interested parties will have the opportunity through the formal rulemaking process under the Maine Administrative Procedure Act to provide comments on the newly covered service design and credential. So the anticipated and preliminary service overview. Early Developmental Support Services, or EDSS, are potential new covered service which Maine Care intends to propose under Chapter 2, Section 106, School Health Related Services. Interested parties will also have opportunities to provide feedback during the rulemaking process. EDSS will include 3 categories of covered services. 1, screening and assessment. 2, the individual and group skill building. And 3, parent training and support. These services are designed to support optimal child development across cognitive, social emotional, adaptive, communication, psychomotor, and physical domains, including vision and hearing, to promote each child's functional development and long-term outcomes. So for the covered services, there are three components. The first component is the screening and assessment. Providers must deliver screening and assessment services using department-approved, research-based developmental screening tools administered with fidelity by qualified professionals in collaboration with parents or caregivers. EDSS services are appropriate when screening shows developmental delay or risk of delay. Screening tools must be age-appropriate, culturally and linguistically responsive, valid, reliable, and administered by trained personnel. Providers must share results with the caregiver or parent, the child's primary care provider, and the treatment team as applicable. The second component is direct skill building, either individual or group-based. Providers must deliver skill building services in conjunction with an evidence-based early childhood education model and curriculum, and are based on the child's assessed needs and treatment plan. Service approaches may include modeling, guided practice, task analysis, role play, visual supports, prompting and fading, positive reinforcement, and generalized strategies. The third component is parent training and support. Parent training and support services must use the Research Units in Behavioral Intervention, or RUBI. So eligibility for EDSS services. Main care members from birth through age 7 who meet one or more of the following criteria. Developmental disability or delay as documented by a physician, clinician, or other licensed practitioner of the healing arts within their scope of practice under state law. Or children identified with developmental disability or delay or at risk of developmental disability or delay as indicated by department-approved developmental screening. Or a child aged birth through 6 years who has a diagnosis from a physician, including a psychiatrist, of a specific congenital or acquired condition with a written assessment by a physician, including a psychiatrist, that there is a significant probability that because of that condition, the member will meet the functional impairment criteria above, later in life if medically necessary services and supports are not provided to the member. Or a child age birth through 3 who is at risk of experiencing developmental delays because of a biological or environmental factor that can be identified and documented, including low birth weight, respiratory distress as a newborn, lack of oxygen, brain hemorrhage, infection, nutritional deprivation, a history of abuse or neglect or homelessness, or being directly affected by substance use disorder or withdrawal symptoms resulting from prenatal drug exposure. The anticipated provider qualifications is the developmental specialist. So Main Care and the Office of Child and Family Services have established a new state provider definition for EDSS service delivery to address workforce capacity and expand access. The developmental specialist can qualify through one of the following pathways. Through one main infant toddler credential, or the preschool credential, or family childhood credential, or the child development associate or CDA. And inclusion credential ages 3 to 5, or associate degree in early childhood education, or a bachelor's degree in early childhood education, or an endorsement 282, teacher of children with disabilities, birth to age 5, or a certified behavioral health professional with OCFS approved training in developmental screening, family engagement, and IDEA Part B or C plus one of the following: a bachelor's degree, 90 credit hours in a related field, or an associate degree or equivalent with 2 years of relevant experience, or educational technician 3 with OCFS approved training in developmental screening, family engagement, or IDEA Part B and C. So the anticipated provider and program requirements. Staff delivering EDSS in licensed child care settings must meet background check requirements. All EDSS staff must be registered in Maine's Professional Development Registry. Providers must maintain OCFS approval to deliver EDSS services. Eligible provider types include licensed mental health agencies, licensed child care programs, state independent educational units, and other providers and/or programs approved by Main Care in collaboration with the Maine Department of Education. Program supervisors must be developmental specialists with a minimum of 5 years of experience in early childhood education. The anticipated service delivery standards. One developmental specialist can deliver individual services per session. For group services, one developmental specialist can serve up to 2 children ages 0 to 2 and children ages 3 to 5 according to established ratios. A parent or caregiver must take part in each session delivered in a member's home. A parent or caregiver must take part in one session weekly in sessions delivered in a child care or other preschool setting. The EDSS Ruby training. So an anticipated new service, Ruby, or the Research Unit in Behavioral Intervention, is a parent training program focused on autism and behavioral intervention. It is designed to help parents and caregivers manage challenging behaviors in autistic and developmentally disabled youth through evidence-based practices. The program is grounded in applied behavioral analysis, ABA, and positions parents as critical agents in the intervention process, providing them with strategies to decrease problem behaviors. The eligible practitioners employed or contracted by this school would complete the Ruby training conducted by a provider certified to train other providers in Ruby. The qualifications are providers must have completed a Tier 1 Ruby training. For EDSS skill building, also an anticipated new service, skill building service are for members 7 or under who have or are at risk of developing a developmental disability or delay. The services are intended to retain or improve functioning abilities that have been negatively impacted by the member's cognitive or functional impairment. Services focus on behavioral management, behavior development, and or the acquisition, improvement, or retention of developmentally appropriate skills. The eligible practitioners are also employed or contracted by the enrolled school, include the developmental specialists. The qualifications were provided on the prior slide for that developmental specialist. And now I will turn it to Jillian to walk through the interested party engagement process.
Thank you, Sasha. So I am going to walk through the provider survey and the independent rate model process on the next few slides. The interested party feedback is a critical piece of service design, and it will be used to inform the rate assumptions in the service rate build. So the purpose is intended to collect baseline data to support an understanding of actual and anticipated provider costs and inform payment rate assumptions for the services that we've talked about on the prior slides. Participants will include school administrative units, childcare agencies, or other agencies delivering and anticipating to deliver school health related services that have been included in this rate determination process. The survey will be released after this meeting and will be due by June 19th. So a little over 2 weeks to complete the survey. And the type of data requested will include service delivery costs, including those related to direct care and clinical care, staffing and supervision, billable and unbillable time, employee benefits, administrative costs, and transportation costs. The survey is in Excel and it will be accessed via a web link. The instructions are embedded in the survey and throughout the Excel document, and I will share the Excel document in a few more slides here and talk through some of the instructions as well. So moving on to the independent rate model and what that is. The independent rate model is a ground up approach. So this means that rates are built from the ground up based on a sum of independently determined rate inputs and components, which will be based primarily on information we're able to receive in the provider surveys. These inputs are based on expected resources required to provide the service, and customized assumptions are based on provider input, as I mentioned. This is a commonly applied method for rate determination for community-based services. Many states employ the independent rate model approach, and it is an acceptable method based on guidance from CMS. regarding rate development for Medicaid-funded home and community-based services. Some benefits of this approach: it provides transparency as to the reasonable costs that are required to provide the service. Focuses the interested party dialogue on measurable and objective rate components rather than just the rate as a whole. Supports payment rate updates and modification efforts in the future. Also facilitates comparison of actual costs of providing services. Additionally, standardization supports rational relationships between rates for different services. And as mentioned before, it's developed independently, so it's not based on actual or not, it's not tied to historical costs. So the independent rate model framework is made up of 4 key elements. It is a flexible framework, but the 4 key pieces that go into the unit service rate are the staff and supervisor salary and wages. So this includes things like direct and indirect time that staff are working, the wages of those staff, PTO and training adjustments, any overtime and on-call costs, and then also supervisor ratios for staff that are providing direct services. The next component is employee-related expenses. So this includes the employee-related taxes and fees for those staff in the first bucket, and also includes employee benefits like health insurance and retirement benefits. Additionally, there are transportation expenses. So this would include mileage paid to employees for use of own vehicles to provide a service. And then finally, administration, program support, and overhead. This includes essentially all other operating expenses like management, staff positions, accounting, legal, IT, etc. Some sources that are often used to inform the rate buildup: the Bureau of Labor Statistics, or BLS, has wage data that can be reviewed specific to Maine and surrounding states. Additionally, there's information available from BLS on workers' compensation costs, retirement benefits, health, dental, vision, and life insurance costs as well. The Internal Revenue Service includes standard mileage reimbursement rates, FICA percentages and limits, and FUTA tax percentages as well. We also review other rules and regulations, so published policies and guidance by the state. This also includes the Maine paid family and medical leave regulation and the costs that are required of employers there. And then finally, the interested party feedback. So technical subject matter work groups, survey data that we'll be collecting in the survey after this meeting, and other feedback we receive from interested parties. Okay, so I will take over the screen share now and share the survey. Okay. Can everyone see my screen okay? Okay, great. So this first slide, or first tab in the file, is the instructions. I just want to touch base on a couple items here just to make sure it's clear. We've bolded them as well. Some tabs throughout the workbook will be grayed out based on selections that are made on the initial information attestation tab, which we'll get to in a second. But I just want to be clear that there will be grayed out areas in the survey that you're not expected to answer. So don't be concerned if you do see tabs or questions that are grayed out. Additionally, we're only asking for one response from an administrator, so such as a superintendent, school business officer, or special education director per school administrative unit, childcare agency, or other organization. This is primarily because this administrator would be expected to provide information on staff wages and benefits, and we only need that from one party at the organization. However, multiple surveys may be submitted from service providers. So there's a lot of tabs in this survey that have very specific service questions. So if there's a school nurse, for example, that would be beneficial to provide answers to the school nursing questions, we welcome multiple responses in those cases. Just quickly touching on the glossary, there's a pretty large glossary here with terms that you'll see throughout the survey. I won't go through those, but that's a helpful reference. So jumping into the information and attestation tab, this is where I talked about you may see some things grayed out. So for example, here the question is asking if the organization is currently a main care provider. If you answer yes, there's no additional questions. If you answer no, there's additional questions like when do you plan to begin providing those services? I won't go through all of those, but that's essentially how it works, just so you're aware. I have selected options here just so everything pops up throughout the survey as we go through it, but these will be blank when you get it, so it will show select. And this question is very important, selecting your role. So if you are a provider, an administrator, an early childhood care and education provider, or a school health related provider, or any other interested parties, this is where I talked about if you choose administrator, it'll sort of direct you to all of those staffing and benefit type questions, where if you were to select one of the provider options, you wouldn't see all of those sorts of questions. And then additionally, question 4 is relatively important as well. This is asking about the specific services, if you provide them, and can provide additional information on the following tabs. And then in row 32 in the red, the survey will highlight for you based on the selections you made to questions 3 and 4, what worksheets you need to go through and complete. So the staffing worksheet, which is expected to be completed by administrators, has the different types of staff that we discussed that could provide the school health related services. So psychologists, Ruby trained practitioners, EDSS skill building specialists, which we've included the different credentials there, nurses, etc. The questions are the same for each provider type. It's asking for feedback on preliminary assumptions. So we have a preliminary wage from the BLS data that I mentioned. And so we're asking for providers to give feedback on those assumptions, if they pay a different wage or if they agree with that wage, that sort of thing. Similar questions below, there's the average number of days staff are scheduled to work in a year, average turnover rates of staff, average hours paid as overtime, on-call costs, training hours, and PTO, including holidays. And there's examples in blue on each tab of how you could provide feedback as well, if that is helpful in knowing how to answer or what kind of feedback to give. I'll also highlight at the bottom here, there's a few additional questions. One asking how many hours are in a typical school day, and then the remainder are primarily asking for the breakdown of different staff. So for example, school psychologists were asking for what % of those hold master's degrees versus doctoral degrees. And that just helps understand the wage wages a little bit more. Moving on to the benefits tab, similar to the prior tab, there's preliminary assumptions. Some sources for those assumptions, since many of them are publicly available data and information, and then feedback on the assumptions. Some of these are grayed out, so you'll see here, and that's because these are federal or state mandated tax limits and tax percentages, so we're not asking for any feedback on those, but included them for your reference. Moving on, the next several tabs are the service specific tabs, so I won't go through these in too much detail, but just want to talk through what they look like and how they work. Some of them you need to scroll to the right. So for example, there's several questions over here that you need to scroll to view. And similarly, there's a lot of grayed out questions. So on this tab, we're asking, do you provide this type of test? And if you say yes, then there's several follow-up questions. If you do not, then there's no further questions asked about that service or that test. Similar, many additional questions down here, things like the approximate no-show for the service, what percent of services are performed in the school setting. There's some travel questions, etc. I won't read through all of them, but you're welcome to send questions if you have any specific questions about a certain question. The next few tabs are pretty similar. So this tab was specific to the psychological testing. The 6B is specific to the outpatient therapy services. There's then school nursing services. This is another tab where you need to scroll over to the right pretty far to get through all of the different types of activities. And then 6D and 6E are related to EDSS, which we talked about are anticipated new services. So we understand that providers are not currently providing these services, but we're asking for information if you are interested and do anticipate you may want to provide this service in the future. We're collecting feedback on these as well. That's kind of the main tabs where we're collecting information. Tab 7 can be used if you have any additional notes you want to include that you weren't able to fit in the feedback on the other tabs. And then tab 8 can be used for if you have any survey feedback. This will just help us in the future with preparing future surveys. If there's anything that you wish could have been done differently, definitely let us know. And then the final tab, I'll just mention this scratch pad here is just for your use. You can do whatever you want on this tab. It will not be used by DHHS or us for any reason. That's just for your own use if helpful.
Thanks, Jillian. I'll bring up next steps. Give me a second.
Thank you. So I will talk through the next steps now. So today we had the kickoff meeting. So as I mentioned, the provider surveys will be distributed via the presented materials notice following this presentation, and this notice will be posted to the Maine Care Rate System Reform webpage. The completed surveys should be submitted via email to maincareRateDetermination@milliman.com. That email is also included on the instructions tab in the survey, so you can easily find it there. And it is due by June 19th. The other school health clinic services survey, so the separate survey we touched on a little bit earlier in the presentation, is forthcoming and will be released in June 2026 with 2 weeks to complete that as well. And then any questions as you're completing the survey, please feel free to reach out to the Maine Care Rate Determination email as well. We'll be monitoring that inbox and are happy to answer any questions as you're working through the survey. And then after we get provider surveys in later this summer, we will evaluate and follow up on those survey results with the interested parties. Now I will pass it back to Maine Care to facilitate the comments and questions.
Okay, thank you. As people are thinking, if they have any questions or comments they'd like to make, and then we will bring the presentation down. I just wanted to kind of go over again that how you can ask a question as you raise your hand, your virtual hand, and try to keep your question to a brief to give other people a chance to ask questions. You raise your hand by using the reactions for the participants at the bottom of your screen. I didn't see anybody on the phone, so I'm not going to go over those instructions. And as we're taking the presentation down and giving people a minute to raise their hand or put something in the question box, I want to remind everyone that today's meeting is recorded and we will be sending out another notice that will have the links to this recording, the PowerPoint itself, the link to the survey that you saw today. And also it is posted at it will be posted on our rate reform website page. So you will get to the link to the survey from the notice. So you'll have to see the notice on the website and click that link. The link itself won't be on the website. So it's all set. If you'd like to take the PowerPoint down and see if anybody has any questions and like to raise their hand or add something to the Q&A. And as Jillian said, if you don't have a question today, or as you're getting questions, if you're filling out the survey or you're reviewing something, the email box that's going to be provided or was provided in today's presentation is a perfect way to contact Milliman to get your questions answered. I'm not seeing any hands raised. I'm not seeing anything in the Q&A. We did establish in the presentation that we would give until June 19th for the surveys to be submitted to the email box provided. Okay, I just want to give like 30 more seconds for anybody to raise their hand. Sometimes it just takes a minute for someone to ask the first question, or we'll take it as we did a really good job explaining everything, and maybe the questions will come in as you're going through the survey. I'm not seeing any hands raised or any questions, so we'll go ahead and end the presentation. But again, we'd like to thank you very much for attending our presentation tonight. And we look forward to your participation on the survey and the future survey. And please reach out with any questions that you have. And we're happy to have you as part of this process. Thank you very much and have a great evening.